Hi everyone, welcome back to Face It with Dr. G. I'm Dr. G and I'm so excited to have you guys back today. I was thinking really hard about what would be interesting and not too scientific, but something that's very relatable to your practices if you're an injector in the aesthetic medical field and also if you're a patient. So today I'm going to talk about why we should do a follow-up visit and when I do follow-up visits. So I like to have follow-up visits with my patients as soon as 2 weeks after that initial treatment, which would specifically be for something like a neurotoxin, Botox, Dysport, Xeomin, or Jeuveau. And then with other injectables like collagen stimulators, I'll see patients back anywhere between 4 to 7 weeks. But I'm going to go through some of the reasons why I think it's really important. And I'm going to focus on the 2-week follow-up period. And let's start with first-time patients. So you see a patient in your office for a consultation and they sit there, and this is a fact-finding, get to know you visit. And at the end of the day, you say, okay, time permitting, we're gonna do a treatment. So we're gonna treat you with a little bit of Botox or Dysport today, Xeomin or Jeuveau. Is that how we wanna start? And I love to see these patients back in 2 weeks because one of the key points that I'd like to get across with my patients is I'm getting to know you and your anatomy as well as you know yourself. And I'm also allowing you to get to know yourself better. And specifically with upper face neurotoxin, it's a very challenging area to inject. And it's challenging when you realize what you don't know. The anatomy is intricate. There are agonistic muscles, there are antagonistic muscles, and you have the eyebrows, the eyelids, the eyes, the cheeks. You have the hairline, you have the forehead, you have the nose is in the midface, but it's still sometimes affected by your upper face treatments. So you need to not only gently show your patients about their anatomy so they understand why you're doing what you're doing, but let them know, I want to see you back in 2 weeks. That is how I learn as a provider. It facilitates that relationship with your patient. It builds trust, and it also, most importantly, teaches you about their anatomy. And one of the key things I say to patients when they're very complex is, I'm going to dose you lightly, and this may seem cliche, but I'm going to dose you on the lighter side. You come back in 2 weeks and we can adjust. We can always add. And that shows me the strength of your muscles. It shows me muscles that are weaker, and it gets me to a point where that result is going to be perfect time and time again. And the biggest thing after that is make notes. Write your notes down. Remind yourself about patients and how they responded to your treatments. I had a patient today that was almost the impetus for this podcast, actually, who came in and she sat down and she had the biggest smile on her face. And, I'm really guilty of being overwhelmed by maybe the least favorable outcomes, because we all have outcomes that we don't love, that we can manage, but we don't love. And those seem to overwhelm my brain, and I remember those more than I remember the amazing moments. But today I had an amazing moment with a patient who was so thrilled. She said, I came in here and I had all of these issues. I had seen this provider before and I wasn't super happy with the relationship and whatever it may be. And she said, I gave you a lot of requirements. And I said, I want a little movement, but this eyebrow is different than this eyebrow. And I want to leave a little bit of lift on one eyebrow, but I don't want the other one to move. And, it was complex. And I try to always deliver my best treatment. And she came in and she was so happy. She said, you did every single thing that I asked for, with a little bit of eyebrow lift, the little bit of movement in her forehead, and she was so happy. And if I hadn't seen her back for that 2-week period, she was probably really happy. A happy patient is one you typically don't hear from as much. But I got to see her. We didn't do any treatments when she came back, so I honored her time, her energy coming here for me to see that result and to learn more about her. So that was so, so, so important. So that's one of the main reasons why I see people back at 2 weeks. The next reason why I like to see patients back at 2 weeks is for swelling. So patients specifically with lips, also with cheeks, depending on the product and the utilization of different needle versus microcannula, patients will swell differently and asymmetrically. And it's super important that you are very open with your patients about swelling. And with lip patients, I like to see them back in 2 weeks. The bruising has gone down, asymmetric swelling has gone down, the product has settled. To be honest, I believe the month mark or 4 weeks after the treatment is the most amazing results, and that's when all of the product is settled. But we choose 2 weeks. They come back and they get an adjustment. This isn't another full treatment. This is an adjustment. This is fine tuning. This is if you had swelling because of a bruise that's now resolved, let's fine tune that result. They don't pay again, and again facilitates the relationship. It helps the injector grow their skill because they're seeing the patient, they're seeing what they did, how that product settled, what result it gave them, and then what to do from there. So I think that is really beautiful. Another reason why I like to see patients back at 2 weeks is for implementation of a new skincare routine. So as you all know, I am a passionate skincare advocate. I love ingredients, I love brands, but I love ingredients more. And I really like to fine tune patients' regimens. So we give all first-time patients little goodie bags of skincare samples of the Soy Your Skin collection. And I also encourage patients to bring in the names or the physical products that they're using at home so we can optimize the routine. More often than not, I see overuse of exfoliants like lactic acid, azelaic acid, and other drying ingredients that we just need to fine tune or maybe take a pause with for a certain amount of time while we optimize those ingredients. And so seeing patients back at that 2 week mark really helps not only see a result, it gives me feedback on maybe something that they don't like with my skincare routine that I recommended or the products that helps give me feedback and helps me grow, and it just helps get on the right track. So 2 weeks seems like a great time to get used to products and then adjust even more. Another reason why I like to see patients back at 2 weeks is when I adjust my treatments and do something a little different. And I'm very open and honest with all my patients about continuous learning, and I do things differently day in and day out with new things I learn, new ways that muscles respond to treatments. And I say this hesitatingly because it has to be on the right patient that loves you, respects you, is a long-term patient that you're open and honest with. I'm going to do this a little differently this time. I want you to be in touch with me to see how this result is. And I've done this a little bit this week, actually, after being at a conference this past week in the Master Series in Miami, learning some new techniques for neurotoxin, advanced neurotoxin injection, and advanced temple injection, actually, with fillers. So I did these treatments. I want to hear from the patients. I want to see them back in 2 weeks and see how they're doing. So if you're implementing new treatments, new protocols, new procedures, whatever it may be, that's another reason to keep in touch with your patients. Another reason to see patients back in 2 weeks, or possibly even more ideally the 4 to 6 week mark, is when you're using products that are slowly building and collagen stimulators. They're bioregenerative, building your own cellular tissues, your own collagen tissues, and your own elastin tissues. So you can't monitor what you don't, no, I said that wrong. You can't manage what you don't measure. You can't manage or monitor what you don't measure. And so one way I really love to use ultrasound in my practice is to measure the dermal thickness, to measure where you've injected products like Sculptra or other biostimulators, to see the thickness of the skin and the deeper tissues, the subcutaneous tissues, to see that Sculptra and what happens to that what happens to those tissues. The other thing is measuring the width or the thickness of muscles. So specifically the masseters. We inject masseters all the time to decrease the girth, decrease the strength. We use it for symptom management with TMJ, or we use it for actual facial slimming. How do you monitor and manage those patients if you don't measure what you're doing? So seeing them back in 2 to 4 weeks has really helped my practice, helped the patient management, helped the results, and also facilitated that patient relationship. And another reason why I like to see patients back is to form a plan. A lot of times when you see patients for the first time, they are interviewing you just as you're interviewing them, and they may do a treatment at that appointment, or they may not. But it's your time at that 2 week mark to form a plan. Then tell them, let's be in this long term. Let's figure out what's best for you. You're feeling great now, and they're ready to continue. So the bottom line is, this is really relationship building. You are there for them. You care. You want to see them. That's how you learn, and that's why patients will stick with you for the long term. You can show them their before and after photos. You can talk to them about their personal life, all of these things. So I believe in that 2-week follow-up appointment. I know some providers think it's a waste of time. You're not bringing in revenue, you're not bringing in money, it's a waste of time. But in my mind, why are we doing what we're doing? We're doing this to build relationships, to create beauty, to create confidence, to have those long-term goals with patients, because the reality is these treatments take time and we're in this for the long haul. So I hope that helped. I hope you enjoyed it. Go figure out your 2-week follow-ups and let me know if you have any questions. Like, subscribe, and I'll see you guys next time.